There have been numerous breakthroughs in oncology over the past 30 years. Most of them started after we cracked the human genome. But since then, there have been a lot of new drug approvals. Most of them are targeting specific mutations on the cancer. And the amount of knowledge it takes to keep up with this is enormous.
So being one of the 3 precision oncology pharmacists, we get consults from any of the oncologists here at St. Luke's and occasionally outside oncologists as well. We are kind of the first go-to people. We do a comprehensive workup of the patient, look at all their genomic results, compile them, and basically based off those results, we put together a profile and make our recommendations. And then we also bring those recommendations to a tumor board and discuss them amongst the oncologists here. You know, the genomic consults are kind of an evolving process, and one of the very cool things about it is we're able to tailor recommendations a lot more personalized to these patients and their tumors specifically, compared to what our guidelines and standard of care options can do.
We have an individual with stage 4 esophageal cancer, which is considered incurable. And because of the precision medicine directed therapies, he's in complete remission. And now it's been many years.
My experience has been very good. It started probably 2 years ago. The doctor knew what he was doing, there's no question about it, Dr. Bansal. I started feeling better pretty quickly after I started that regime. And I've been given information here as of late that effectively the cancer is cured, and the drugs, of course, had a lot to do with it.
The healthcare team has provided a significant difference in my journey, because without the full oncology, nurses, as well as radiation, surgery, it really takes a medical team to really support and to work on this very specific rare cancer. So you have to go where all the professionals are, and typically with my cancer, you have to utilize the precision-based type medicines that are being developed out there for people today.
Pathology in general is the foundation of medicine. It is really critical and integral part of all practices of medicine, particularly in oncology. We are becoming more and more involved in patient care, particularly with the new era where the word individualized or personalized medicine has become more and more the standard and not the exception. So we are really involved quite a bit in that multidisciplinary team.
We do have data that shows our molecular tumor board guided therapy has made a survival benefit compared to other physician standard of care or physician treatment choice. And so that's one way that we have data to go behind some of the evidence or some of the clinical evidence to our recommendations making an impact.
I am the medical director of gastrointestinal oncology, and I also work with Dr. Bansal to lead the Center for Precision Oncology. We have a really dedicated team of pharmacists, bioinformaticians, and physicians, as well as other staff that keep track of how patients are doing and how our targeted therapy recommendations influence those patients' lives.
Currently, we pathologists are involved in multidisciplinary programs in almost every disease organ, breast cancer, lung cancer, colon cancer, and the like. We participate very actively in that process, not just in providing diagnosis, but providing guidance to help the oncologists and surgeons in taking care of patients.
So after we do a complete workup of the patient based off their tumor and genomic sequencing, we take them back to a tumor board. And so when patients or providers of the patient refer that patient to us, we invite them to that tumor board and give our recommendations along with our providers' recommendations based off their sequencing. And then we also place an official note in that patient's chart summarizing those recommendations as well, which could include standard of care, lines of therapy, off-label therapy, as well as potential clinical trials that they may or may not be eligible for.
So the role of pharmacy is pretty pivotal, I would say, for the Center of Precision Oncology. We look at all the genomic results as they come through in live time, and we tag patients for specific targeted therapies that may be available, either investigational or commercially approved agents. And we notify providers that there is a therapy that the patient may qualify for.
We have numerous research collaborations with various organizations across the country to try and use this genomic data to help fine-tune treatments.
Doctors are really good about fighting with me because without them, I couldn't do what I do. Without their knowledge, and I might be doing the footwork for them, but the physicians, they'll stop what they're doing at any point to do a peer-to-peer, which is another doctor talking to that doctor about that patient and why we want to treat them and why we should be able to treat them.